Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. This lecture discussed a severe life-threatening psychiatric condition that is called as bipolar disorder, also known as a manic depression. In such condition, the patient usually presents suffering from mood swings with either depressed mood or an elevated mood. So the patient with bipolar disorder usually having an episodes or more of depression in addition to an episodes or more of mania. Bipolar disorder is commonly misdiagnosed and too often insufficiently treated. The precise etiology of bipolar disorder is still unknown. However, genetics play an important role in development of such condition. Also, bipolar disorders is influenced by a variety of factors that may enhance gene expression, and these factors including trauma, environmental factors, anatomical abnormalities, and exposures to chemicals and drugs. The pathophysiology of bipolar disorders remain incompletely understood. However, historically, the condition or research focused on the neurotransmitters, including norepinephrine, dopamine, and serotonin, that play an important role in development of such condition. One hypothesis is that the bipolar disorder is caused by an imbalance of cholinergic and catecholaminergic activity. Serotonin suggests to modulate the catecholamines, and the dysregulation of such relationship can cause mood disturbance. Also, genetics play an important role in the development of bipolar disorders and in the pathophysiology of bipolar disorder. For a clinical presentation and diagnosis of bipolar disorders، وقبل ما نتطرق لها نشوف هاي الصورة اللي توضح لي الموست common signs and symptoms associated with the bipolar disorders. طبعا أول شيء bipolar المقصود بترجمتها ثنائي القطب، فهنا البيشنت اللي عنده bipolar disorders usually suffering from two conditions, from depressive episodes and from the manic episodes. وحدة عكس الأخ. الdepression characterized by depressed mood and low level of energy، والmanic episodes characterized by elevated mood and increased level of energy. The onset of bipolar disorder is usually between the 18s and 30 years old range, and most commonly occur in adolescence. وغالبية المرضى اللي عندهم bipolar disorders نسبة كلش عالية من عندهم هم من الطلاب الجامعيين. Patient with the manic episodes characterized by elevated mood, expansive mood, irritable mood. Also, the speech of such patient tend to be loud, rapid, punning, poor judgment, clanging, and vulgar. فتشوفه دائما يتكلم بسرعة، يتكلم بصوت عالي وبسرعة، وكلامه يكون كله إثارة وتشويق. Also weight loss, grandiose، يحب نفسه، يمجد بنفسه، يكبر بنفسه، يقول أنا دائما أنا لو ما أنا فلان شغلة ما راح تصير، وهكذا. distracted، hyperactive، decreased need for sleep، inappropriate of dress and the flights of idea. وهاي inappropriate of dress نقدر نشوفها بهاي الصورة. البيشنت اللي عندهم المصابين بالبايبولار ديسوردرز دائما تكون ملابسهم الوانها صارخه اللي احنا نسميها مزركشه، فبها عده الوان بالاضافه لعدم التناسق بيناتها. فنشوف هاي الصوره انه القميص اخضر مورد وكل ورده لونها شكل، بالاضافه للبنطلون المقلم بالاحمر والماروني، الحذاء وردي. فهنا نشوف الوان صارخه وماكو تنسيق بيناتها. زائدا اذا كانت فيميل مصابه بالبايبولار ديسوردرز ايضا راح يكون مكياجها النوع الصارخ والالوان الكلش قويه، فتكون الحمرة مبالغ بها، الكحله مبالغ بها، المسكارا مبالغ بها، وهكذا. هاي كل هالاعراض دائما نشوفها بالبيشنت من يكون عنده ان episodes of mania. عكسها patient with an episodes of depression. طبعا هنا نخلي بالنا شغله انه لازم اكو previous manic episodes before the development of depressive episodes، فلازم اكو manic episodes مصاحبة للdepressive episodes. إذا ما كن manic episodes هنا راح يتشخص البيشنت having major depressive disorders or other types of depression. Also, feeling of worthlessness, guilt, hopelessness, increased anger, irritability, decreased interest, negative view, fatigue, decreased energy, decreased appetite, insomnia, libido, and suicidal preoccupation اللي هي دائما نخاف من عندها. Any patient with depression usually having an attempt or suicidal attempt. So, patient presenting with the depressive or elevated mood, depressive mood or elevated mood features with a history of abnormal or unusual mood swings should be assessed for bipolar disorder. bipolar disorder categorized into four subtypes أربع أنواع رئيسية. bipolar 1, bipolar 2, cyclothymic disorders, and other specified and unspecified bipolar or related disorders. حتى فرق بيناتهم bipolar 1 characterized by a period of major depressive episodes اللي تطرقنا لها سابقا، والإضافة إلى major manic episodes and or mixed episodes. فيكون عنده major depressive episodes and major manic episodes. bipolar 2 period of major depressive episodes plus hypomanic episodes. والهايبومانيا اللي هي خلينا نعتبرها المايلد فورم اوف مانيا. اللي المانيا طبعا السيمتومز نفس السيمتومز تقريبا اوف مانيا، لكن المانيا تطول سيمتومز لمدة أسبوع أو أكثر. الهايبومانيا 4 أيام أقل، يعني تستمر لمدة 4 أيام. فأي شيء 4 أيام وأقل هاي هايبومانيا، أكثر من 4 أيام تحول إلى المانيا، فمايلد فورم اوف مانيك episodes. السايكلوثيميك disorders اللي هي period of mania of hypomanic episodes and a period of depressive episodes that do not meet all the criteria and of diagnosis of the major depressive episodes. فهي طبعا characterized مثل disorders characterized by a period of depression and hypomanic not sufficient to be a major depressive episodes and not sufficient to be a major or hypomanic episodes. فتكون يكون mild form of mania plus mild form of depression. Defining features of the bipolar disorders is the presence of one or more manic or hypomanic episodes in addition to depressive episodes that are not caused by medical condition, substance abuse or psychiatric disorders. فهنا حتى أشخص البيشنت عند bipolar disorders لازم عنده one or more manic or hypomanic episodes plus one or more depressive major depressive episodes. هنا طبعا main point is that the majority of the episodes is mostly depressive, and the study showed that a bipolar 1 patient spent about 32% of the week with depressive symptoms compared with 9% of week with manic or hypomanic symptoms, while the patient with bipolar 2 disorder spent 50% of the week's symptomatics for depression and only 1% with the hypomania. So because the patient may present with depression and spend more time depressed than with the mood elevation, so bipolar disorders is often misdiagnosed or underdiagnosed. وعليه احنا طرقنا لها انه الدبريشن كذا تايب اوف ديبريشن، واحده من عندها البايبولار ديسوردرز. انه البيشنت دائما يعاني من الاعراض الدبريشن تكون طاغيه اكثر من هي اعراض المانيا او elevation اوف ذا مود. فهنا misdiagnosed or underdiagnosed، يعني حتى الشخص المعالج مرات ما يقدر يوصل للديفرنشال diagnosis bipolar disorders because of the appearance of the depressive episodes more than that of the manic episodes. Bipolar 1 disorders characterized by or require the presence of at least one episode of mania for at least 1 week, or persistently elevated mood, expansive mood, irritable mood related to other symptoms with decreased sleep or decreased need for sleep, excessive energy, racing thought, propensity to involve in high-risk activities, and excessive talkativeness. Bipolar 2 disorders distinguished feature of bipolar 2 disorders is the current or the past hypomanic episodes and the current or past depressive episodes. Irritability and anger also present, and also there cannot have been a prior full manic episodes. هاي بنخليها ببالنا انه لازم يكون عندي hypomanic episodes تقريبا لحد ال4 أيام symptoms of mania for at least 4 days, not more than of the 4 days. Cyclothymic قلنا أن mild form of the mania and depressive episodes. Chronic mood disturbance lasting for at least 2 years or 1 year in children and adolescents, and characterized by mood swing that include a period of hypomanic symptoms, do not meet the criteria for hypomanic episodes, يعني mild form of hypomania, addition to depressive symptoms, do not meet the criteria for the major depressive episodes or the mild form of depressive episodes. Suicide. Patients with bipolar disorders have high risk of suicide. Factors that increase the risk are the early age of onset حقنا من 18 ل 30 سنة, high number of depressive episodes, comorbid alcohol abuse, personal history of antidepressants induced mania, and family history of suicidal behavior. Diagnostic features for the mood episodes, and first with the major depressive episodes اللي تطرقنا لها require greater than or equal to 2 weeks period of at least 5 different symptoms. One of these symptoms either of depressed mood or loss of interest or pleasure in normal activities in addition to other symptoms. فأسبوعيا 5 أعراض، واحدة أو اثنين من هاي الخمس أعراض depressed mood and depressed mood and decreased interest in pleasure and activity in addition to depressed appetite, insomnia, psychomotor retardation or agitation, decreased energy or fatigue, feeling of guilt or worthlessness, impaired concentration and decision making, and suicidal thought or attempts. For manic episodes require greater than or equal to 1 week's period أول شغلة of abnormal or persistently elevated mood, expansive or irritable mood. ثاني شغلة in addition to at least 3 of the following features or 4 if the mood is only irritables. فأسبوع أو أكثر duration المود should be elevated mood, expansive or irritable with at least 3 of the following symptoms. Inflated self-esteem, grandiosity اللي احنا قلناها، يمدح بنفسه، يمجد بنفسه، يكبر بنفسه، أنا الشخص لو ما أني فلان شغلة ما راح تصير، وهكذا. Racing thought or flight of idea اللي هو اللي نسميها rapid change person rapidly shift between conversation topic أو سرعة الكلام واختلاف المواضيع وعدم اللحاق به. يعني يبدأ الشخص يتكلم أول شيء عن الدراسة، وعلى غفلة يتحول على السيارات، وعلى غفلة يتحول على العقارات، ووراها على الزراعة، وراها على الصناعة، وراها يرجع على الدراسة، يرجع على المسلسلات، على الأفلام، وهكذا. يعني تعاقب الأفكار، تعاقب التوبكس during conversation بشكل كل سريع بحيث الشخص المقابل أو الشخص اللي دا يستمع له ما يقدر يلحق به. وعليه أنه persons rapidly shift between the conversation topic أو سرعة الكلام مع اختلاف المواضيع، إضافة إلى عدم القدرة على اللحاق بالشخص بالمواضيع اللي دا يطرحها الشخص، فهي يسموها racing of thought or flight of idea. Distractible, poor attention, increased activity or increased motor activity or agitation, increased excessiveness involvement in activities that are pleasurable but have high risk for the serious consequence. من ضمنها poor judgment in the business venture، اللي تشوفه على غفلة حط كل فلوسه بالبورصة وهو ما يعرف شنو هي البورصة وما يعرف شلون يتعاملون وياها، حط فلوسه بالبورصة لو أربح لو أخسر. فهاي إنه يفرح أو يشعر بالسعادة من يشارك بهيج مواضيع، لكنه high risk for a serious consequence. هاي بالنسبة للمانيك episodes. الهايبومانيك episodes نفس الماني، احنا قلناها mild form of the manic episodes، لكن الدوريشن راح يكون عندي قليل at least 4 days of abnormal 4 days. هاي أول شيء abnormal or persistently elevated mood. ثاني شغلة associated with at least 3 of the following symptoms اللي هي ثالث شغلة. 3 شغلات لازم تكون عندي موجودة: duration 4 days, persistently elevated mood, and 3 of the following symptoms: inflated self-esteem, decreased need for sleep, increased talking, racing of thought, increased activity, excessive involvement in activities that have a pleasure but having high risk for serious consequence. And next type criteria for both major depressive episodes and manic episodes except for the duration، هاي هنا أسبوعين هنا أسبوع أو أكثر، that occur every day for at least 1 week period. 2 conditions. والرابid cycling at least 4 mood episodes depressive, manic, mixed or hypomanic that occur in 12 months. Desired outcome and the goal of treatment for the patient with the bipolar disorders are to reduce the symptoms, induce remission, prevent relapses, improve patient functioning, and minimize adverse effects associated with the drug therapy. General approach of treatment suggests that the mood stabilizing agents, in addition to the antipsychotic drugs that mean the first line treatment for a treating patient with suffering from bipolar disorders, treatment of acute mania, treatment of depressive episodes, and treatment of even that of the mixed episodes. Because the early and accurate diagnosis is essential to maximizing response to treatment, pharmacological and non-pharmacological therapy should be begin as soon as possible. Treatment is often lifelong. هنخليها بالنا. Chronic condition required lifelong therapy throughout the life of the patient. فهنا adherence to drug to treatment is an important factors in treating such patient. Hypomania, the first line treatment for hypomania اللي هي احنا قلناها initiating mood stabilizing medication lithium, valproate or carbamazepine, even in combination with the benzodiazepine, diazepam والclonazepam for short-term adjunctive treatment for agitation or insomnia. ما جاب نتيجة الفيرست لاين، حول على السكند لاين اللي هو الcombination of two drug combination. Mania can be treated with the 2 or 3 drugs, lithium mood stabilizing agent with benzodiazepine for short-term adjunctive treatment in addition to antipsychotic agents اللي أنا راح أضيفها after alternative medication not response to such patient, carbamazepine or oxcarbamazepine. Second line therapy inadequate, consider 3 drug combination. With third line non-pharmacological ECT electroconvulsive therapy for mania with psychosis or catatonia. Catatonia, lack of movement or communication in patient with bipolar disorders. Treatment of mild to moderate depressive episodes. نحن هنا نقطة نركز عليها انه الدبريشن هنا patient عنده depression، لكن ما راح انطي نفس التريتمنت اللي انا انطيته بالبيشنت اللي عنده فقط ماجر depressive disorder. هنا البيشنت عنده bipolar، عنده manic episodes وعنده depressive episodes، فهنا راح انطي تريتمنت للحالتين، للمانيا and for depression اللي هي المود stabilizing agents drug of choice، واضيف عليها الانتي سايكوتكس agents. هاي بالنسبة للمايل تو مودريت مود stabilizing agents أو anti convulsants. والسيفير depressive episodes راح نعطيها المود stabilizing agent والانتي سايكوتكس agents، وراح أضيف لها الانتي depressants for treatment of severe depressive episodes in patients with bipolar disorders. Second line treatment inadequate response considers adding atypical antipsychotics. هناك استخدام atypical هنا atypical antipsychotics. الثird line combination therapy، والfourth line use of non-pharmacological therapy اللي هو ECT electroconvulsive therapy. Non-pharmacological therapy including cognitive behavioral therapy which is a type of the psychotherapy العلاج المعرفي السلوكي type of psychotherapy that stress the importance of recognizing pattern of cognition or thought and how the thought influence the subsequent feeling and behaviors. So the cognitive behavioral therapy changing perception which is the relationship between the thought, behaviors and the emotion. احنا قلناها face-to-face interview through the face-to-face interview between the patients and the therapist whether psychologist or psychiatrist. نظام جلسات ويا المريض. هنا المريض عنده negative thought regarding his condition. هنا لازم نغير الثوت of this patient. What we think affect how we feel and act. فهنا نتغير thoughts of the patients regarding his condition. هنا راح نقدر نغير behaviors and نقدر نغير emotion associated with the bipolar disorders. With CBT patients are taught self-management skills to change negative thought اللي هي مسيطرة على المريض even if external circumstances do not changes. فهنا قلنا patient face-to-face interview with the patient، وضحنا انه انت عندك المرض الفلاني وهذا حال باقي الامراض، تاخذ علاج، عنده علاج معين، تاخذ العلاج راح تتحسن حالتك، ما راح تاخذ العلاج راح تتدهور حالتك. Another non-pharmacological therapy is the electroconvulsive therapy which is the application of an electrical impulses to the brain for a treatment of severe depression, mixed state, psychotic depression, and the treatment of refractory mania. And this condition involves the induction of generalized seizures inside the brain through the administration of an electrical impulses by using this bipolar pole directly to the brain. And this generalized seizures can cause change in the chemistry of the brain, therefore lead to the change in the concentration of neurotransmitters that involve in the development of the bipolar disorders. طبعا هاي هنا طبعا تحتاج انه should be done under generalized anesthesia to perform such procedure. Also, education for the patient, families, and the group about the chronicity of the bipolar disorders. The chronic condition required lifelong therapy. It's an important point. And they also educate the patient about the self-management through the sleep hygiene, nutrition, exercise, stress reduction, and abstinences from alcohol or a drug that critical to success. Also, education of the patient regarding the benefit and risk of drug therapy and the importance of adherence. يعني نركز عليها should be adequately adhere to therapy to get adequate improvement in his condition. To treatment, importance of adherence to treatment must be integrated into the pharmacological management. The primary pharmacological treatment modality for the manic episodes first is the mood stabilizing agents with antipsychotic drugs in combination. فهنا الأول شيء حتى أعالج المانيك episodes أحنطي mood stabilizing agents ويا الانتي drugs. For a primary treatment for the depressive episodes الحالة الثانية in bipolar disorders is the mood stabilizing agents أيضا with certain antipsychotics. الحالة الثالثة primary treatment for relapse prevention. Relapse prevention is the mood stabilizing agents often combined with the antipsychotic drugs. فبالثلاث حالات اللي عندي اللي هي primary treatment for manic episodes, primary treatment of depressive episodes, and the prevention of the further relapse or relapse prevention is the using the mood stabilizing agents اللي هي lithium, divalproex, carbamazepine or lamotrigine, in addition to the antipsychotic drugs, first generation and the second generation antipsychotic drugs. That is, a second generation involve risperidone, olanzapam, quetiapine, ziprasidone, aripiprazole, and others. So this is the primary treatment for the manic episodes, for the depressive episodes, and for the prevention of relapses in patients with bipolar disorders. Mood stabilizing agents is the first line treatment or the first choice for a treatment for patients with the bipolar disorders. This is including lithium, and the lithium prototype of the mood stabilizing agent that is act as anti-manic, prevent relapses, treatment of mania, prevent relapses, and also modest efficacy for acute bipolar depression. فهنا يستخدم treatment of acute episodes of mania, acute episodes of depression, and also prevention of relapses. Mechanism of action of lithium is not well understood, and its multimodal possibilities including alter ion transport, effect on neurotransmitter signaling, block adenylyl cyclase, effect on inositol, neuroprotection or an increased BNDF, brain-derived neurotrophic factor, protein that is found in the brain, play an important role in the maturation and the growth of the neuron inside the brain, in addition to the protection of such a neuron. Also inhibition of the second messenger system. Dosing of the lithium ranging from 600 to 900 milligram per day, given in divided doses or single daily dose. Once daily dose is usually preferred that improve adherence and reduce renal side effect of lithium. Lithium having narrow therapeutics index، والليثيوم طبعا واحدة من الأدوية اللي راح تتطرق لها إن شاء الله بالثerapeutics drug monitoring that having narrow therapeutics index. The small increment in the dose lead to appearance of toxicity. فهنا لازم أتعامل ويا الليثيوم عن طريق السيرم serum concentration of the drugs rather than on the dose. Serum lithium serum concentration ranging from 0.6 to 1.4 milliequivalent or millimole per liters. The concentration that is required, higher concentration, often required to treat an acute episodes, while the serum concentration of 0.8 or more, greater than above 0.8 millimole per liters, effective for preventing relapses. فهنا أنا أريد أعالج الأكيوت episodes of mania, acute episodes of depression. لازم أحصل serum قبل أحسب الدوز depend on the higher serum concentration of lithium, serum concentration 1.2, 1.3 or even 1.4. هاي الأكيوت episodes. بينما إذا أريد preventing relapses لازم أحسب الدوز depend on the serum concentration that is equal to 0.8 or 0.9 or even 1 millimole per liter. فهنا الغرض من الثerapeutics drug monitoring أني أدرس ال TDM أو أحسب الدوز عن طريق المعادلات الكيميائية، معادلات الفارماكوكينيتيك equations أو النوموجرام methods depend on the serum concentration to overcome the toxicity that associated with the drug that having narrow therapeutics index. طبعا the serum concentration should based on 12-hour post dose sample collection, usually morning trough. والserum therapeutic drug monitoring should be done at least 2 weeks, every 2 weeks after the normalization or the finding the dose that is adequate for the treatment of such patient for acute episodes and for prevention of relapses. Most common adverse effect associated with the lithium is the gastrointestinal upset, nausea, dyspepsia, and diarrhea that can be minimized by co-administration with the food, or the use of the sustained release formulation, or giving smaller doses more frequently to reduce the amount of drugs in the GIT. Also, tremor that can be minimized by administration of low-dose beta blocker propranolol. And another adverse effect is the polyuria, because the lithium impairs the kidney's ability to concentrate urine because of its inhibitory effect on the vasopressin or antidiuretics hormone. This can cause an increase in urine volume and the increased frequency of urination and increase in the thirst. Lithium also concentrates in the thyroid gland and can impair hormone synthesis. Acute lithium toxicity, that is, can occur when the serum concentration greater than 2 millimole per liters. Such patient having such condition characterized it as a severe and life-threatening condition, necessitating emergency treatment. Symptoms including severe vomiting and diarrhea, in addition to deterioration in motor coordination, including tremor, ataxia, dysarthria, and impaired cognition. Treatment include first, discontinuation of lithium; second, administration of IV fluid to correct IV fluid, replacement fluid to correct fluid and electrolyte imbalance that result from severe diarrhea and vomiting associated with the toxicity of lithium, in addition to osmotic diuresis or hemodialysis to get rid the lithium from the circulation. In case of overdose, gastric lavage can be indicated. Clinical symptoms continue after the serum concentration is lower because the clearance from the CNS is slower than that of the serum, and factors predisposing to lithium toxicity including fluid and sodium loss from the hot weathers or excessive or exercise, in addition to drug interaction that can cause increased serum lithium concentration. Drug that inhibit metabolism of other drugs. Second mood stabilizing agent is the divalproic sodium and the valproic acid. احنا تركيزنا على divalproic sodium, which is composed of the sodium valproate and the valproic acid. Upon the administration of the delay release and extended release formulation, usually converted into the intestines into the valproic acid. وإحنا drug of choice or the component of choice for the treatment for the bipolar disorders, which is systemically absorbed. It is FDA approved for a treatment of the manic phase of the bipolar disorders and efficacy equal to that of the lithium, which can be used as monotherapy or combination with lithium or antipsychotics agents. Mechanism of action is not well understood. However, it is known that enhance the activity of the gamma aminobutyric acid, and similar to lithium, has a neuroprotective effect through the enhancement of the brain-derived neurotrophic factors. Dose usually range from the 500 to 1000 milligram per day, and this dose can cause serum drug level ranging from 50 to 125 microgram per month. أيضا الأدوية الفالبرويك أسيد اللي راح تتطرق لها إن شاء الله بالثيرابيوتكس drug monitoring. Suggested serum concentration is based on the trough value. نخليها ببالنا trough value. And the serum concentration monitoring is recommended at least every 2 weeks until stabilized, and then less frequently. Most common adverse effect is the GIT adverse effect, loss of appetite, nausea, dyspepsia, and diarrhea, which can be overcome by co-administration with the food. Tremor also overcome by the administration with the beta blocker propranolol, drowsiness, and also weight gain. Most common adverse effect associated with the use of valproic acid or even divalproic sodium. Carbamazepine, the extended release formulation, is the FDA approved for a treatment of bipolar disorders. Although the efficacy for the mood stabilization is less desirable as first line agents, ما يستخدم حاليا هو second line or even third line treatment because of the safety and drug interaction. As we know that the carbamazepine is enzyme inducer that have a wide range of interaction, فهنا ما يستخدم first line treatment. It is here for the patient who fail to respond to lithium or for the patient with the rapid cycling or mixed bipolar disorders. Carbamazepine can be used as monotherapy or in combination with lithium or with other antipsychotic drugs. Mechanism of action is not well understood. However, it blocks ion channels and inhibits sustained repetitive neuronal excitation. But whether this explains its efficacy as mood stabilizer is still not known. Dose range from 400 to 600 milligram per day, and this is adequate to produce a serum concentration, therapeutic serum concentration of 4 to 12 microgram per ml. أيضا الكربامازيبين الأدوية اللي هتطرق لها إن شاء الله بالثيرابيوتكس drug monitoring. Dosage can be increased by 200 to 400 milligram per day over every 2 to 4 days. وهنا كل ما أزيد الدوز كل أسبوع أزيد الدوز كل أسبوعين أسوي لها therapeutic drugs monitoring until stabilization of the dose. Most common adverse effects are include drowsiness, dizziness, ataxia, lethargy, and confusion. والنقطة المهمة إن carbamazepine is an inducer, auto-inducer, even induce its own metabolism, so the dose may require to increase after 1 month or so of therapy because of this effect. فأبلش 200 ملغ ورا شهر أسويها 400 لحد 600 يعني أبي شوي شوي أزيد بالدوز كل أسبوعين. الجايد لاين كل أسبوعين هنا أيضا يذكر إنه كل أسبوعين أو كل 4 أيام 4 أيام إلى أسبوعين أظل أزيد بالدوز إلى أن أوصل للماكسيمم دوز أو stabilized dose that adequate for the prevention of acute attack, prevention of relapses and treatment of acute episodes. Lamotrigine also effective for maintenance treatment of bipolar disorders, more effective for depression relapse prevention than for mania relapse prevention. In addition, maintenance monotherapy is sometimes used in combination with the lithium or divalproex. Most commonly use of lamotrigine. Mechanism of action mechanism include involve blockage of ion channels and affect glutamate also affect on glutamate transmission, although the precise mechanism is still not clear. Dose dose of lamotrigine is initiated at 25 mg per day for 1 to 2 weeks and then increased to maximum dose every 1 to 2 weeks to reach the target of 200 to 400 mg per day. Serum concentration is not recommended for lamotrigine. Adverse effect including micropapular rash, that is occurring 10% of the population, which is usually benign and temporary, but certain population converted to Stevens-Jones syndrome اللي هي هاي هنا. فتبدأ أول شيء ماكروبابيلار راش اللي هو البناين فورم وتتحول للستيفن جونسون syndrome. Oxcarbamazepine, that is analog of the carbamazepine, developed as anticonvulsant, والفيتشرز مالتها or advantage over carbamazepine that routine monitoring of the hematology profile and serum concentration is not indicated. Also, benzodiazepine can be used as adjunctive therapy for short-term treatment اللي هي 2 drugs أو 2 agents, clonazepam and lorazepam, adjunctive therapy treatment of insomnia and the treatment of anxiety. Omega-3 fatty acid also have been a role in the mood disorders but not appear in treatment guideline. Antipsychotics, the first generation antipsychotics اللي هي chlorpromazine والhaloperidol use the treatment of acute mania as first line treatment, with second generation include aripiprazole, acinapine, olanzapine, quetiapine, risperidone, and ziprasidone are approved for the treatment of bipolar mania or mixed mood episodes as monotherapy or in combination with the mood stabilizing. فأنا يا إما استخدمها واحدة as first line therapy or combination with the mood stabilizing. وهنا approval of antipsychotic النقطة المهمة approval of antipsychotic in patients with bipolar disorders appear without regard to the presence of psychosis. مو إلا البيشنت عنده psychosis حتى أنطي antipsychotic، لا، إنه البيشنت عنده bipolar disorders أنطي بغض النظر عنده schizophrenia لو ما عنده. هاي أيضا نخليها ببالنا. Treatment guideline including antipsychotic drug as first line therapy, combination of mood stabilizer and antipsychotic is more likely to achieve remission than the monotherapy. Dosage in the bipolar disorder similar to that and the schizophrenia، وإن شاء الله هاي المحاضرات القادمة إن شاء الله نتطرق لها بالتفصيل. treatment antipsychotics and treatment of the schizophrenia. Higher doses often required to treat acute episodes. Finally, antidepressants احنا قلناها البيشنت with can be used for patient with severe depression episodes and bipolar patient with bipolar disorders that having severe depressive episodes in addition to the mood stabilizing and antipsychotics agent. Guidelines agree that when antidepressants are used, they should be combined with the mood stabilizer to reduce the risk of the mood switch. And thank you.